I'm not gay, but I am a nurse. But I'm not gay. In The Politics of Nursing Knowledge, Anne Marie Rafferty writes, "What is clear is that nurses appear to be no exception to the sociological orthodoxy that a weak group often subordinates a weaker one to improve its status. Gender discrimination against men in nursing is a problem for more than just the 6% of nurses who are men." In this speech, I will discuss the problem of reverse gender discrimination in nursing, the effect it has had, and potential solutions for it. We must stop sexism against men in nursing. You'll agree that it's ridiculous and disgraceful to let discrimination of any kind continue. Men weren't always a minority in nursing, but they were placed there. When Florence Nightingale wrote the book on nursing, she relegated men to the role of physical labor. Formalized training became available for nurses in 1860, but men were not allowed until 1888. And by 1903, many schools still did not allow men. In 1892, about half of nurses were men. By 1902, only 19% of nurses were men, which is still higher than today's figures. Men in nursing have been discriminated against just like women in the men's world. They were not allowed to become head nurse. Under the new rules of nursing, nurses were forbidden to marry, or in many cases even to live off-site, making nursing a less viable option for men who were wanting to start and support a family. Men were allowed to care only for men, especially violent patients, such as alcohol withdrawal or mental illness, and men with urological problems. Men were forbidden to care for women or even children, nor were they allowed to work with the elderly. Gender discrimination in America got much worse before it got better. According to O'Keefe, in Nursing Practice and the Law, only 1% of nursing students in 1972 were men. This improved to 5% in 1996 and 10% by 2006, according to the Chicago Institute for Career Research. The U.S. Department of Health and Human Services states that in 1980, only 2.7% of all registered nurses were men. This doubled to 5.4% in 2000 and increased to 6% in 2006. We see now how gender discrimination in nursing came about, so let's try to understand some of the effects of the problem. Nearly 20% of all male nurses would not recommend a man become a nurse. Primary causes cited are discrimination and sexist practices. Many other problems from the Nightingale model continue to plague male nurses. One, the relegation of men in nursing to the function of heavy labor continues to this day. Male nurses and students find themselves frequently taken from their duties to help lift or reposition a patient. In an interview with Eric Swanson, RN, on July 24, 2010, he states, "I've been asked many times to lift a patient or turn a patient or pick a patient up because I'm a man. In fact, according to a survey of 498 male nurses by the Bernard Hodes Group in 2005, retrieved July 22, 2010, 56% of male nursing students complain about being used by female nurses for heavy lifting. This only gets worse after graduation, as 71% of male registered nurses complain about this problem." O'Keefe cites a case in which a skilled nursing facility refused to hire a male applicant based on gender. So men are still being forbidden from working in certain fields by certain institutions. The Hodes Group also reveals that men in nursing continue to complain of being passed over for promotions because they're men. 2. The unnecessary addition of the qualifier male to nurse, i.e., women in nursing are nurses, men in nursing are male nurses. This one distinction has been proposed by many to be the reason behind much of the bias against male nurses. A further concern is that nurse means to breastfeed, and that is a sexist term to begin with. Some prefer men in nursing, although others would prefer attendant, orderly, or, like Eric Swanson, medic. Whatever the name, this is seen by many as a serious impediment to equal treatment. 73% of all male nurses cite stereotypes as the biggest obstacle they face in becoming nurses. But 82% are concerned that we need to end them. 1. Men in nursing must be gay. Half of all male nurses say they've had to deal with this preconceived notion. Admittedly, some male nurses are gay, as are some males in all professions. 2, men in nursing are those who cannot become doctors or are studying to be doctors. 3, men are incapable of the compassion necessary to be a nurse. Other concerns of men in nursing are common to all nurses, male or female. A survey of 76,000 registered nurses performed by the American Nurses Association and reported by Medical News Today in 2005, retrieved on July 23, 2010, reports that nearly 37% of American nurses are dissatisfied with their jobs. This is the minority, but compare this percentage to the only 10 to 15% of people in other occupations who do not like their jobs, reported by the U.S. Department of Health and Human Services. The ANA study states that only 53% of nurses say they enjoy the jobs they have. Nurses in general cite 2 primary factors for this: low respect and low pay. So, we've discussed the effects of gender discrimination in nursing, but what can we do about it? Only when we see that it's a problem can we begin to fix it. Why should you care? In Nurse Educators in Politics, writer Sandra Koff states that nursing is among the most sharply sex-segregated of professions. It seems that because this is a sort of reverse sexism, that it's more tolerable. But how can we grow as a free country if we tolerate gender discrimination in any form? Koff suggests that women are more tolerant to bureaucracy than men, possibly as a consequence of a history of subservience. This has actually done more damage to nurses as a group than men in particular. Without representatives, who will fight for greater recognition and compensation? So what can be done? 1, keep the male nurses we have. The American Assembly for Men is a nationwide support group for men in nursing. Hire more male charge nurses and directors. Lift your own damn patient. 2, attract more men into nursing. Change the name to something more gender neutral, like medic or attendant. And women. Women need to be more vocal in combating these stereotypes about men in nursing. Gender discrimination against men in nursing is a serious problem, for which we now know the cause, effects, and possible solution. We need to end reverse gender discrimination in nursing. Who knows? Someday you may need a nurse who's a real man.